Diphenhydramine, commonly known as Benadryl, it is an antihistamine. It's a H1 blocker. The way it works, it blocks H1 histamine receptors in the respiratory tract, vasculature, and GI smooth muscle. One of the effects of it is it will decrease motion sickness, and that's mainly in the GI tract, of course. It also decreases extrapyramidal reactions like muscle tremors, paranoia, slurred speech, stuff like that. You usually get that as a drug reaction, so that is handy for that. Pregnancy class is going to be pregnancy class B. Some indications, allergic reactions including blood product reactions, anaphylaxis, of course, extrapyramidal reactions like we mentioned, and then nausea in pregnant patients. It works, and it's a safer drug to use than something like Zofran, safer for the baby. Contraindications, allergic to antihistamines, believe it or not, it's possible. Used with caution in asthma patients, it actually thickens the bronchial secretions, so we want to not give it to the asthma patients. And then narrow angle glaucoma is another contraindication. Some adverse reactions, kind of a bunch of them that we have to watch for: drowsiness, sedation, dizziness, headache, blurred vision, like we mentioned, thickening of those bronchial secretions, wheezing, dysrhythmias, hypertension, diarrhea, nausea, vomiting. The main one on that is it causes some drowsiness, sedation. That's the biggest one that we have to look for. With kids, though, it can have kind of a just the opposite effect, and then cause central nervous system excitation, including hallucinations. So it's kind of interesting how it can rev up the kids, whereas with most adults it makes us sleepy. Drug interactions potentiates other central nervous system depressants, including alcohol, and MAOIs prolong and intensify the anticholinergic effects. And it does increase the effects of epi, and that's why we use it together in anaphylaxis to get rid of those symptoms. Adult dosage standard 25 to 50 milligrams, IV, IO, IM, PO, pretty much any route you want to give it. Pediatrics 1 to 2 milligrams per kilogram, IV, IO, IM. Takes about 10 minutes usually to start working. Peak effects in about an hour, and then duration is 3 to 12 hours, so it lasts quite a while in there. And there's not really any special considerations to note on this one.